neonatal sepsis. Initially, we should classify neonatal sepsis according to onset of action into early onset sepsis and late onset sepsis. Early onset sepsis is sepsis which occur in the first week of life according to the Center of Disease Control CDC. The source of infection may be transplacental or ascending infection or aspirated vaginal secretions. While late onset sepsis, which have the abbreviation LOS, presents after the first week of life and is either community acquired or nosocomially acquired infection. And here we should stress on that nosocomially acquired infection is characterized by being due to virulent and resistant microorganisms. Risk factors for neonatal sepsis are either maternal risk factors or neonatal risk factors. Maternal risk factors like premature rupture of membrane, it has the abbreviation PROM, and it occurs when there is rupture of membrane and delayed delivery, which increase the risk for infection. Also, intrapartum fever more than 38, which indicates the presence of bacteremia or viremia and also rise the risk of infection. Also, chorioamnionitis, it means infected placenta and amniotic fluid. Premature labor, antepartum or intrapartum asphyxia and need for neonatal resuscitation also is a risk factor, and maternal UTI. Neonatal risk factors like prematurity per se is considered a risk factor. Endotracheal tubes, central lines and peripheral intravenous lines, any line or any interference with the normally skin barriers is considered a risk for sepsis. Also, formula feeding is considered a risk for sepsis if compared to breastfeeding. Total parenteral nutrition is also a very serious risk factor. You are giving it intravenously and it is a nutrient material which is a good media for infection and it is prepared from day to day. Also, mechanical ventilation is considered a risk for neonatal sepsis and pneumonia. Clinical manifestations of sepsis. The most difficult and the most challenging point in sepsis may be non-specific and often subtle clinical findings. الأعراض بتاعة السبسس غير محددة وكمان ساعات بتبقى مبهمة، أعراض مش واضحة بشكل كامل. هندي مثال زي إيه؟ في respiratory signs like apnea, tachypnea and other signs of respiratory distress. GIT symptoms like poor feeding, vomiting, diarrhea, abdominal distension and ileus. بعض الأعراض دي فعلا موجودة في النيوبورن وما بنعتبرهاش مشكلة في حد ذاتها، وبالتالي بتبقى misleading لينا في أحيان كثيرة. الهايبوثيرميا، وهنا ده شيء specific للنيونيتال sepsis عن other types of sepsis أو sepsis في other age groups. other age groups دايما characterized by fever or hyperthermia، ولكن في النيوبورن نتيجة الامباتيوريتي of الهيت ريجولاتوري سنتر بتكون الهايبوثيرميا هي الأغلب. Other clinical manifestations of sepsis like jaundice and hepatomegaly, hypoglycemia or hyperglycemia, lethargy or irritability, seizures, bulging anterior fontanelle, hypotension, poor perfusion or shock, DIC. الآخر ثلاثة presentations دول طبعا هم specific وما ينفعش يتقال عليهم subtle، ولكن diagnosis of sepsis by the presence of these signs is considered late diagnosis of sepsis, and so it is have a poor outcome. Common microorganisms, they are classified into gram positive and gram negative microorganism. Gram positive, the most common and the most known one, is the group B beta hemolytic strep. It has the abbreviation GBS. Also other organisms like Staph aureus and coagulase negative staph. While gram negative organisms include Klebsiella, Pseudomonas, Proteus, and E. coli. And unfortunately, these are the most common causative organisms of sepsis here in Egypt. Then, what are neonatal sepsis? These are examples for neonatal sepsis. What's meant by neonatal sepsis? It means the presence of infection with systemic inflammatory response syndrome, SIRS. We have some examples like septicemia, pneumonia, meningitis, UTI, septic arthritis or osteomyelitis. How to diagnose sepsis? We have laboratory and radiological investigations. First of all, we do CBC. We may find leukocytosis, white blood cell count above 25,000, leukopenia, which is an ominous sign with white blood cell count below 5,000, neutropenia with absolute neutrophilic count below 1,500, thrombocytopenia may be found. Also, other acute phase reactants like positive CRP and high ESR may be present. But here we should stress that positive CRP or C-reactive protein is not highly sensitive or highly specific test, and to increase its specificity we may do serial tetris of CRP. Then for culture, the gold standard for diagnosis of neonatal sepsis is positive blood culture, but we should say that it is a good positive test. Means that if we are suspecting neonatal sepsis and there is a positive culture, so it is a sure sign of the presence of sepsis. But if we are suspecting sepsis and blood culture is negative, this does not eliminate the diagnosis of sepsis. It is not a good negative test. Other cultures which may be done like urine culture, CSF culture, local sites cultures like tracheal aspirate and aspiration from the infected joint, and skin wound culture. Radiological diagnosis is done according to the area of infection. In pneumonia we do chest x-ray, in arthritis or osteomyelitis we do x-ray long bone and joints, in the presence of necrotizing enterocolitis we do x-ray abdomen. Also in CNS infection, ultrasound and CT are done. Then how to treat neonatal sepsis? We have early onset sepsis and late onset sepsis. In early onset sepsis, the patient is either asymptomatic or symptomatic. If the patient is asymptomatic, so he is a well newborn with no symptoms, but he have some of the risk factors we mentioned before. We do CBC and CRP and start antibiotics empirically using ampicillin and gentamicin to cover gram positive and gram negative organisms causing neonatal sepsis. Then we will follow the newborn for the following 48 hours. If the patient is clinically stable and the investigations are negative, we can stop antibiotics and discharge the baby after 48 hours. If the patient is symptomatic, symptomatic وفي early onset في first week of life. Also we do CBC, CRB and blood culture. And we start ampicillin and gentamicin. And here we can add third generation cephalosporin if the patient is critically ill with a duration of 10 to 14 days. If the baby had late onset sepsis, we should do CBC, CRB, blood culture, CSF, and urine culture. As we should stress, the incidence of meningitis is higher in late onset sepsis, and meningitis is characterized by being newborn. It may be silent, it needs specific antibiotics with specific dosage to cross blood-brain barrier. Also, it may leave the baby with a long-term sequelae, so it is important and it should be excluded in late onset sepsis. We start empirically penicillinase resistant antibiotics like vancomycin and amikacin, which is one of the aminoglycoside or third generation cephalosporin. Then we modulate the antibiotics according to the results of the culture. For the duration of therapy, in proven sepsis, it is 10 to 14 days. In meningitis, 2 to 3 weeks. In osteomyelitis or septic arthritis, we give treatment for 4 to 6 weeks due to diminished blood flow to these areas. And